Riley is in school. The way treatment works, for girls it's 2.5 years, and for boys it's 3 full years. The first year is very intense, and during that time Riley was not in school. There's 5 different phases, and you go through the first 4 phases of treatment during the first year. And each phase is slightly different based on what medications they're given and the dosages and how frequently they're given. So during the phase called delayed intensification, that was when we were essentially living at the hospital. We were there all the time, multiple times during the week. Right now we're in what's called long-term maintenance, and that is kind of like the light at the end of the tunnel. Right now she takes an oral chemo medicine every single day, and we go in if anything comes up, because she has a port that is a direct mode for bacterial blood infections. So if she gets any fevers over 101, we go directly to the ER and they'll draw blood cultures. So there are plenty of unplanned visits simply because, especially during cold and flu season, they're exposed to so much, and most of the time it is just a cold, but we have to be safe and always go to the hospital. So in addition to the unplanned visits, right now we go once a month for IV chemo, and on every 3rd month she gets a lumbar puncture where they put chemotherapy directly into her spine. Rylie was kind of a unique case at diagnosis because they always check to make sure that the children at diagnosis don't have blast cells or the cancer cells in their cerebral spinal fluid. And Rylie tested negative. She did not have it. Unfortunately, during some questioning, I told them that she had been having some visual changes. So when they were putting her port in, they looked into her eyes and they saw that her optic nerves were affected by the cancer. So we knew that at that point she would have to have cranial radiation. So that was pretty intense. It was every day for 3 weeks, and she did great. She did not have to go under anesthetic. A lot of kids at that age, they have to put under every radiation treatment, because they essentially bolt them down to the radiation table with a mask. And Rylie was a big girl. She did it all completely awake, and she did great.